My name is Dr. Simon K. Kimani. I'm the head of the Department of Public Health Sciences in the Faculty of Public Health Sciences. In this department, we have several programs. We have the higher diploma programs. We also have the diploma program and the certificate program. The first one is higher diploma in epidemiology. These programs takes 18 months. The entry requirements for this program is that one must have served for 1 year in the practice of their fields. The fields that we take are diploma in environmental sciences or public health sciences, diploma in nursing, diploma in medical laboratory sciences, diploma in clinical medicine, diploma in health records and information, diploma in community oral health. The second program is higher diploma in food science and inspection. This course also takes 18 months. The requirements for this course is that one must have served for 1 year and they must possess a diploma in public health sciences or environmental health sciences. The next program is higher diploma in occupational health and safety. This course also takes 18 months. The entry requirements is 1 year experience in the field. The diploma, various diplomas are public health sciences or environmental sciences, nursing, orthopedic technology, occupational therapy, medical imaging sciences, medical engineering, and any other health-related diploma. The next higher diploma is solid waste management. This course also takes 18 months. The entry requirements is diploma in public health sciences or environmental sciences and a 1 year experience. The next higher diploma is higher diploma in medical social work, gender-based violence. This course also takes 18 months. The requirements for this course: one must have worked also for 1 year. They must have a diploma in medical social work or a diploma in social work and having worked in a health facility in our country. The next course is diploma in public health sciences. This is a pre-service course that takes 3 years. The entry requirements for this course is that one must have mean grade of C plain in English or Swahili, and biology or biological sciences, C- in mathematics and either physics, physical science, or chemistry. The next diploma is diploma in public health sciences in service program. This is a 2-year program. The entry requirements in this area is certificate in public health sciences or environmental sciences with 2 years working experience in the field. The next diploma is diploma in medical social work. This is a 3-year program. The entry requirements for this is mid-grade of C, then C plain in English or Swahili, and D plus in biology or biological sciences, C minus in either chemistry, physics or physical science, mathematics, home science, agriculture, business studies, geography, history, CRE or IRE. The next course is certificate in public health sciences. This course takes 2 years. The entry requirements for this course is mid-grade C minus, then D plus in English or Swahili, D plus in biology or biological sciences, and D in mathematics, and also D plain in either physics, physical science, chemistry, agriculture, building construction, technical drawing, or electricity. In opportunities for employment for our graduates operate within about 5 pillars. The 5 pillars, the first one is built environment. Within the built environment, our graduates are able to interact with the building constructions. They are expected to inspect the drawings of all the plans, all the houses proposed to be built in Kenya. They're supposed to look at the health requirements in those plans. then approve those plans. Upon approving, they are supposed to carry out inspection of those buildings. Even as they come up, they team up with another team that comes from the physical planning department, and they become part of that team to ensure they are safeguarding the health of the members of the public in the coming up of that building. Of course, there they also look at the ventilation of the buildings as they come up. They look at the lighting in those buildings, the spacing, the height of the buildings, the spacing of the room, the air exchange in the room. All that, they look at it in the building. And upon the completion of the building, they're supposed to inspect that building, come up with an inspection report. After the inspection report, then they issue what we call an occupation certificate. That is a certificate that every citizen must have before you occupy any building in Kenya as per the Building Code and the Public Health Act, Cap 242. The other pillar that they will look at is food inspection. In food safety and quality control, our graduates are expected to undertake food inspections to ensure that the food that the citizens consume is safe. Here, they are looking at the food in the market at all levels. They may be the meat, for example, they are supposed to monitor the meat itself from the slaughterhouse to the butcheries, even up to the homesteads. How safe is that particular food as provided for in the Food, Drugs and Chemical Substances Act? They are supposed to take samples of the meat that the citizens are consuming to make sure that it is safe and wholesome for food for consumption by our citizens. And they're supposed to undertake various measures to ensure that that food is safe, including CESA, including condemnation, and all that pertains as per provided for in the various acts, including the Meat Control Act and the Public Health Act, and also the Food, Drugs and Chemical Substances Act. In the area of disease control, our officers are also involved in disease surveillance. They ensure that the problems that occur in the community, the disease that may occur in the community is controlled, is contained. They carry out what we call surveillance of the diseases, may it be cholera, may it be the diseases that are coming up like Ebola or COVID-19. They make sure they monitor and they control those infections, either by spraying the facilities or controlling the areas that those diseases are likely to spread, to ensure that the hand washing takes place to curtail the spread, and then of course maintain the control measures by educating the public on those diseases that are likely to occur, that are present, and that are likely to recur again even after suppression upon various interventions. In community health, our officers also carry a very key role. Our officers are in the communities. They are in every village in our country. We have a public health technician in every village in our country. Within that area, the public health technicians work with community health workers, or what we call the community health volunteers, who have maybe a 100 households, and the officer is supposed to undertake 500 households. These are the people that undertake wash activities. The wash activities in the communities. They train people on sanitation, what you should have water, how should you treat your water for drinking, how are you supposed to handle your sanitation facilities at home. We are talking about the village even before you move to a town or a city. Then these officers are supposed to interact with the members of the public. The immunization, have the children been immunized against the diseases as stipulated for? Are they undertaking the malnutrition? Are they malnourished, or are they having light food diets? These officers also assist in the referral process, where you can actually go to a health center or a dispensary, where you can get other health support cadres that are supposed to support our officers. But the ones in the village, the ones at home, are actually the technicians, our public health technicians, who assist the community. And then once they are not able to handle that issue, they refer to the next level, which is the dispensary. Dispensary level refers to the health center and all that. That is the primary health care level 1. The other area is occupational health and safety. Within the health and safety, our officers are supposed to look at the work environment. Where do our people work? How are they supposed to be? The work environment must be safe, must be spacious enough. Where the people are sitting must be healthy. You must have an area that you can sit. For example, the seat you are sitting on, our officers are supposed to check that seat you can be able to sit in that seat for 8 hours without developing any economic challenges that will come up as a result of you sitting there for many hours. If it's a workstation, you make sure that the workstation is well lit, it is well exposed, so that you don't encounter any injuries or any accidents as a result of maybe your work environment being dark. They are supposed to make sure it is well ventilated, so that if it is the emission of any chemical or emission of any contaminant, it is removed from the work environment, so that you don't develop occupational diseases as a result of exposure in that particular area. Other areas is the pollution control or climate change. Because of the instances of the current situation in our country and many other countries, pollution is a big problem. Our officers are supposed to identify the pollution points from where they occur in the work environment. They are supposed to identify the pollution itself, the source of the pollution, and then they come up with a solution. The intervention measures, may it be noise pollution, may it be air pollution, may it be land, may it be soil, may it be any type of pollution that is occurring, including pollution from maybe wastes disposed of by us as members of the public, or by counties through their solid waste processes in the areas where people actually reside. Then in the area of waste management is also important in our country. With the challenges we are experiencing with the garbage in the cities, our officers are supposed to identify the garbage points. They are supposed to advise the county or the county governments on where the disposal can occur. The safe areas. They have safe areas for holding, the holding stations, where you can hold that waste and then dispose it eventually. And even where to dispose and how to dispose that waste at the end of this, so that the waste does not become a hazard to people. It doesn't also become a nuisance to our citizens. It is well provided for in the Public Health Act in the management of nuisances, for example. And any nuisance that is occurring from any area, may it be as a result of waste disposal, it is handled in a systematic way as provided for in the law, and therefore people are not supposed to be exposed to diseases as a result of these nuisances. Our officers are supposed to take control of those particular instances, so that diseases do not occur as a result of that. Our graduates work in various areas in our country. First of all, they are based in the national government. They also work in the county governments. Some of them are also working abroad in many countries, around us and also away from us. Our graduates also work in the non-government organizations. A number of them are in Red Cross, a number of them are in UNICEF, a number of them are in various UN bodies, offering various public health interventions, as we have said. And they are also in teaching. For example, us here, we are offering this service, teaching. We were in public health practice before. Then after that, we joined the profession in teaching. They are also in universities, in various universities. They are also teachers in various universities in our country. And also in consultancy services in the country. So in this case, I would call for any student willing to join us, and those who are willing to work within the public health space in our country and beyond, to apply and start their exciting journey in our Kenya Medical Training College. In the application, you can go to our website, www.kmtc.ac.ke, and you can go to the application portal and apply there online. In our applications, it's very easy. You don't have to know anyone in this institution. You don't have to interact with anyone. Just interact with the portal.
My name is Nicholas Omondi from Kenya Medical Training College, Department of Public Health, and I'm pursuing Diploma in Public Health Science. Upon graduation, I'll be a competent public health officer equipped with skills that will allow me to work in the public. As a public health officer, I'm supposed to protect the public against the diseases and also to prolong their life. Based on my experience, the institution has provided a very good environment for the learning process of the students. There is a sufficient internet, there is also a library that you can do research, and also during the stay in this institution, I've realized that the teachers or the lecturers are interactive with the students one-on-one to ensure that they meet the correct requirements and they're competent in those courses, and they meet the requirements that they are supposed to meet by the end of the 3-year course. And also, the institution has provided a good environment outside there for those people who are going to do the attachment or for the field attachments, to ensure that they get the correct skills that they have learned from the school and they practice it outside there. It is for all these reasons that I will advise any person who will wish to pursue a course in medical to apply at Kenya Medical Training College from the portal. You can access the portal and then you get the requirements that you're supposed to do based on your course that you have chosen.